Hey guys, welcome back to the channel. Today we are going to be talking about our personal experience with doctors and why, although we need doctors and we're appreciative of the things they do for us, we are still a little skeptical. We still have to question things, and we still really have to know ourselves and our body and keep ourselves accountable of the things that we're doing through the doctor's direction. So I wanted to talk to you guys a little bit about my story, dealing with them for the last 12 years. And Carlos is here because he's been with me through most of it. So he's, gonna also be showing his side of the story on, being my spouse and just seeing the things that I've been through this whole time that I've been fighting Crohn's.
Yeah, through both of our views.
Yeah.
Okay.
So if you guys saw the first video we posted on here, that I originally got sick back in 2006, and it took me a whole year to get diagnosed, over a year, because I got sick in June and I wasn't diagnosed until October 2007. And I was very blessed that I worked for a gastroenterologist at that time. But even working for him, I struggled a lot because he was an older doctor, which I love him. We're still very close, 10 plus years down the line. Mm-hmm. But, he was an older doctor, and he wasn't very up with the new times and the new medicines. But I will say this, out of all the doctors I've ever dealt with, he was the only one to preach diet. He was the only one to really tell people that would walk into his office. And remember, I worked for him. Yeah. So I knew the ins and the outs. He was the only one to have people walking out of his office with a diet plan, not always necessarily a bottle of pills or a prescription or a narcotic. He wanted people to be accountable for the things that they were eating and really take charge of, their health, which that was a one-time scenario for me. I've never again met a doctor who does that.
I can second that because I remember we did blood work because he was also my general doctor. Yeah. And I went over there to get some blood work, and that was a horrible diet, eating fast food all the time. And he noticed that my good cholesterol, I think my good cholesterol was lower. I don't know. One of my cholesterols was off by a bit. Yeah. And he told her, right, he's like, you need him to come over here immediately. I need to talk to him right now. Like, I was scared because I thought, I was like, oh my God, I'm going to have a heart attack or something.
He's Italian. He's a little dramatic.
Yeah, he was a little dramatic. So I was like, all right, I went in, and he was like, listen, he gave me a diet plan. I mean, there was no way in how I was going to follow that diet plan. Especially at that time, I just didn't care, was stubborn, and he was like, if you don't change your diet by the time you're 40, he was worried about how I was going to be when
20 years down the line.
20 years down the line if I kept up this habit, which is unique. Yeah. But I think a lot of that has to do with because he is an older doctor, and he was trained at a different time.
Yeah. But because he was an older doctor, I mean, the amount of pills. I mean, I am dealing with something greater than gastritis and high cholesterol. I'm dealing with a disease. So at one point, he did have me on a ridiculous amount of medication. And if you saw our latest, blog post, you'll know that when we met, I would carry around these, quart-sized bottles of medication of Pentasa and Flagyl. And, I mean, I couldn't swallow them anymore. So I was on Flagyl 3 times a day, 500 milligrams 3 times a day. If you've ever had Flagyl, it's like you live with a penny in your throat. Yeah. Like copper is in your throat always.
Yeah. And I remember she looked ghostly because these pills were like taking the life out of her. It wasn't just the Flagyl, it was a combination of you were on some sort of steroid also.
Yeah, you put me in like 3MP, and you
Yeah,
know,
all
it was
all
just
types
like
of.
I
It's
wasn't
pill-
healing. I wasn't getting any true benefit. I'm still getting fistulas at this point.
Yeah, she was getting a lot of fistulas. Like that was when the fistulas were definitely the worst.
The worst, yeah.
And every time we would call him, you were no longer working with him after a while, and he was still having the fistula problems.
Just
And
add
he would
more
call,
flagyl.
and his remedy was just add more flagyl, increase the amount of flagyl. So I told her, I was like, listen, because she had an emotional attachment to him. He was the one that diagnosed, which is huge. And of course, he was taking care of her for years, and they had a personal relationship in the sense that they worked together and all that. So, I told her, I was like, look, no, nothing crazy, but I think maybe we should look at another doctor because maybe someone who's a little bit more up to speed on the newer medicines and things like that. And this was before we really took it upon ourselves to do our own research.
But you jumped a little ahead because while I was working with him, I did change to Cimzia, which is, an intramuscular injection. And Cimzia did help me until I got pregnant and I got off all my meds. I really wanted my baby to be healthy. So I got off everything, and then the fistulas definitely returned, which is how we knew the flagyl and all the things he had me on did not work. They were just masking the disease.
Technically if you ask me, that's what all medications are doing. But it wasn't also that. I mean, it was a combination of you getting off, but before that, you still had, you were in the hospital at least every 6 months dealing with the fistula. Like
for a week or something.
For a few days at a time, if not a week. It was a nightmare, and even with all these medications, besides the fact that her quality of life was on the floor because she just felt like crap all the time.
So we moved on.
Yeah,
right. I love him, but
doctor.
I moved on.
Yeah.
I did my research. I found one of the best doctors, in my area, and I loved him at first. He was great, and he did care for me.
He did.
He did care for me, and he did have good bedside manner. So he did care for me.
Which is hard to find.
But he was a doctor of medicine. So every time I would go in there, I would tell him, doctor, I feel good, but every night I'm still flaring. I'm still getting, my belly looks like I'm 6 months pregnant. And he upped my dosage of Humira. Now I'm injecting myself.
Well, start from when you first got onto Humira.
So when I got off,
I think it was after the pregnancy.
After I had my baby, I decided not to breastfeed because,
she needed to get onto medication.
I needed to get on meds, and I knew that because I had surgery while I was pregnant. So I knew my disease was active.
Right. So
I got on Humira, 1 injection every 2 weeks, which is the normal dosage for most people. But when I changed doctors and I started with this new doctor, I would tell him, around day 10, I'm back to pain and I'm back to inflammation and I'm back to not feeling good. So he upped my dosage to 1 injection, 40 milligrams every week. So I was doing 4 injections a month.
Yeah, and that was the one thing that we do owe to Humira is that really did help the fistulas. Since she got on the Humira, we never had problems with fistulas again.
But I was still getting inflammation. I was still using my hot pack every day. I was still bleeding from, profusely.
Still having intestinal problems.
I still had to get 2 iron infusions, 2 sessions of iron while I was on Humira.
Right.
Yes, it calmed down my fistula.
But then you also grew a bunch of other problems in the sense of
flu-like symptoms,
all the time. Headaches that you would get in and out, headaches, all types of, you list the side effects, and it's funny because you'd be like, oh, I keep getting these headaches, so here I go on Google, get through WebMD, because if you go through WebMD, you have cancer, that's just, you're dead. And start searching, and then when I would go into the side effect list, it got to the point that I would just look up the side effect list first, and then it was like, that's the side effect, and of course she was on a high dose, she was doing it.
And I was still going to the bathroom 4, 5, 6 times a day, even while working a full-time job. Yeah. I'm sure it was very frustrating for my boss at the time.
Yeah.
But and my doctor had me do MRIs every 3 months. I found myself doing an MRI and having to drink this disgusting barium that I'm sure you've had to drink it, and colonoscopies, and it was like, when does the madness stop?
Right. So then what going back to the topic, which is the doctors, and taking everything they say with a grain of salt. I mean, what I started doing is I started going to these doctor visits with her, because I started to realize that food, at that point is when I started to pay attention to more food. And I think it was because we had an episode with popcorn.
I didn't know, because no one had ever taught me,
or me,
in 6-7 years of dealing with Crohn's, that I can't eat certain foods. So I'm healthy and I'm going to eat a whole lot of popcorn. And then...
Well, yeah, I mean, it was a little more complicated than that, but she ended up eating way too much popcorn. I probably ate too much too. And ended up getting a blockage. And with that blockage, I started being more cautious of the foods. And then at that point, that's when the doctor started talking about low residue diets.
Yeah.
And I learned about this low residue diet in the hospital, because that's what they had her on, a purely liquid diet, because she had a blockage.
At first, yeah.
And she had to, pass. They didn't let us go from the hospital. We were there 7 days.
7 days.
And they didn't let us go from the hospital until she passed. And she was starving. I mean, imagine 7 days with no solids. And then
so that's
when I learned about the diet. And my major point every time we went to these doctor's visits was figuring out what she could eat and what she couldn't eat, where she could get her protein sources from, and we were starting to make an effort to exercise too around that time, although we were completely uneducated.
But the point of it is that they took no time whatsoever. I was never sent to a nutritionist.
No.
They took no time
to
explain to me diet.
Right.
Because there's a big thing with the disease that there's no such thing as a specific diet to help people that have IBD. And I get that, because I know people that have IBD that can't eat things that I can eat. Like, I can eat a salad. I know a lot of people that can't eat a salad. I can't eat fruits.
And a lot of people have huge benefits from juicing.
So I get that. There's no one specific diet, but at least give me a roadmap. You're an expert.
Right. They're an expert, but they're trained to treat the disease, not to cure you.
Yeah.
So what they're always going to do, and what they're taught to do, is to give you medicine first.
Yeah.
So what bothered me most about this specific doctor was that everything was what you were practically taught in medical school. It's like, oh, you have a blockage, and the MRI shows that you have scarring in your, I think it was your ileum or something like that. I don't remember exactly, but she had a lot of scar tissue, and the first thing that he's telling us is that we're gonna have to resection that portion of your intestines. It's like, we haven't even gotten through diet. We haven't gotten through any other thing, and you're already talking about cutting pieces of your intestine off.
And it's not a guaranteed cure.
It's not a guaranteed cure, because it can come back. So it's like, so you want to cut me up, and you don't even know if that's going to work.
Yeah.
And I kept telling her, I was like, look, we're going to try everything before we get to that point. And I mean, it doesn't help that I have an aunt with a colostomy bag, and so in her mind, that would take her to that point right away. Is, oh my God, I'm going to be living with a colostomy bag, which is a big step, for anyone. And those that have a colostomy bag, it's a huge step, right? Yeah. That's something that you have to mentally prepare yourself for. So.
And there are some people that are to the point that the Crohn's is so aggressive that they do need surgery.
And we're not writing that off. We're not writing that off at all. But we're talking about the level that she's at, and have we tried everything before we get to that point? And we hadn't. We honestly hadn't even reached the surface. So I hated the fact that it was always drugs and surgery first. Yeah. And and the diet doesn't really matter.
Yeah.
He was always telling us, because he kept saying, stay away from solid foods, no lettuce.
Yeah,
no greens. All the benefits that those foods have, and she couldn't touch them because they were rough on the intestines.
Yeah.
Which is completely not true in her case now.
Yeah.
Don't take everything that they tell you, because she's still going to the doctor.
Yes.
I mean, she suffers from fistulas, and that's something that we do not want to go back to.
Yeah.
You even recently got on Remicade because in prevention for that.
Yeah.
But what we learned is that because the way we're brought up is the doctor knows it all. They're there for your well-being, and you have to understand that they're running a business. They're trying to profit. And I used to be a mechanic, so I can relate with that. Like,
So a big thing that I try to tell people is, when they're like, oh, but the doctor sent me to do 1 million tests, and I'm like, of course, because the doctor does not want us to heal. If he heals each and every patient that walks into his office,
right,
he's not gonna have any more patients.
That's the truth of it.
So and it's just like, I want to put this example out there because it really impacted me.
Right.
My father had a heart attack, almost a year ago, and it was an emergency. He had to go in emergency surgery, so I'm freaked out. I'm sitting in the lobby of the cardiology department waiting for my father to come out of, surgery, and I look to my right or my left, and there's a huge McDonald's sign, eat fries, like, really? Really? In one of the top-notch hospitals in the South Florida area, in the cardiology, like, that's probably what got my dad into surgery. And
it probably wasn't French fries. It was probably more like,
pork, but still, that's not
whatever.
the point.
Yeah.
The point is, and I get very passionate about that, because it's like, we have to be accountable and really keep an eye out on these hospitals and these doctors, and really take,
understand their side of it. Like, they're working for their check. They went to school for a long time. They were taught to treat you with drugs.
Yes.
So that's their approach first, and you put your faith and your well-being and everything in their hands, and nobody's going to care for you better than yourself.
Yeah.
Like, the doctor is not going to heal you miraculously because, no, that's not what they get paid for. They get paid to treat you. They get paid to get sent you to the MRI. I'm sure there's some sort of like affiliation or something there.
For sure.
It's a business, and you have to see it that way. The doctor is trained to treat you, not to heal you, and you take that into account.
Everywhere you go is a treatment option. It's not a curing option.
Yeah,
it's a treatment
and technically
option.
there is no cure, but I've seen a lot of people, with testimonies and stories online that have forced themselves into remission with zero medication, and it's just purely discipline with their diet and the way they live. So I think the best thing you should do when you're visiting your doctor is take all the information he's giving you, and it's not law. It's not. Okay, and I'm going to say this mostly because I'm the person who isn't diagnosed. I don't have a disease. I can listen to it and not be biased to the information. Okay, she automatically thinks, for a long time too, maybe not so much anymore, that the world's ending when they give them specific information or anything, because it's traumatizing. I get it, but me looking at it from the outside, I can tell you that you have to take that information, and dissect it yourself, and understand that that's biased.
Yeah.
That's biased information. So they want to treat you this way with drugs, with surgery in some cases, and in some cases you actually need it, which is why you need to do your own research and then ask yourself, have I done everything? What am I eating? How am I living? Are my stress levels high? Am I happy in my relationship? And you may think not all these things matter, but they do. All of this, there's so many variables that take account into your health, and this is without a disease. With a disease, it's just amplified. So you need to take it into, if they're telling you need a colostomy bag, there's probably a lot of truth to it. But go ahead, go on Google. We live in an age where information is just abundant. Go and do your own research. Find out what section of your intestine is damaged, and figure out what that intestine does in your body. We're not doctors, but the information is there. You can educate yourself. And you may ask, oh, that's a lot to look into. Yeah, but getting a colostomy bag and living with that the rest of your life, that's a big decision. So it doesn't hurt you to be educated. Maybe there's a specific food that you're allergic to. That doctor doesn't want to send you to an allergist or a Rendell's test for you. Maybe you should. Maybe you're eating something that's causing this damage. Maybe. Have you exhausted all your avenues? Maybe not. So, if you're going to take anything from our experiences with doctors and I know this episode was a little bit all over the place. There's a lot of passion in this.
Yeah, and remember, this is our opinion. This is
right.
our story.
How we went through it and how we think you should try to approach it.
Yeah. And it's all, you know, finding your own way.
Finding your own way, but take the information with a grain of salt. Do your own research and check out all the boxes on the list to make sure that you've done everything before you go and you take that drug.
Yes.
Because the drug also brings other things. You have to understand nothing is fixed with a pill. That pill may mask a certain problem, but it's going to give you another list of problems like headaches and all types of other things. So do your research, you know, don't go blindly with whatever the doctor says.
Yeah.
There's more to it than what the doctor says. And that's really what we want you to take out of this episode, you know, and hopefully through our experiences you can see that we had to experiment too.
Yeah.
And ultimately
fixing
the diet and finding things with a combination of what the doctor tells us has really been helping her live a better life in general from front to end. So that's really it. Yeah.
Well, thanks for watching.
And catch you on the next episode.